Okay, so let's talk about national health. Okay, ever since I was a kid, all I've read is that national health is skint, it's broke, it's going bust. Okay, and another headline recently, IVF, that national health, okay, shouldn't be the fallback for people wanting to go through IVF because it can't afford it. What are your thoughts on that?
Yeah, I think that is a valid point. And if you think about it, healthcare costs go up all the time, and interestingly enough, they go up exponentially, so their curve is like that. Now, no government can increase taxation exponentially, there'd be a riot. So taxation can only increase linearly. So over time, the gap between what the taxation brings in and what the healthcare needs are is bound to increase.
Right.
And personally, I think at a national level, we should have a debate. Given what the funds of the NHS are, what should it do, and what should it do well, and what should it not do? Because once you stretch the resources, it starts to do other things unwell, if you see what I mean.
So would you suggest it's there to save lives, not create lives?
Very interesting. That is a more complex debate, because obviously if I was desperate for a child, I'd say, you know, oh, this is unfair. But I think the debate we as a society need to have is say, right, given our limited resources, what should we be using them for? And those who can afford IVF, should the NHS fund it or should they pay it privately? Those who can't afford it and have really good sympathetic reasons for it to be considered, then maybe we could have a debate or some principles around provision for them.
So should we means test everybody in this country to see if they have the right to free
It's a really good question.
Cover.
It's a controversial question, obviously. The NHS was set up on the principle of free at the point of access to everybody. So it would be a huge and radical change to do that. I think the College of GPs at one point did make a proposal around a entry fee for seeing GPs, or like £50 or something like that. What you find is when you have an entry fee, then usage obviously goes down. Sometimes usage is more rational. We all want a fair health system. We want to make sure that those who generally can't afford what they need get what they need. We don't want to go backwards. But equally, there are people who could afford to pay for their healthcare, and maybe that's the balance that we haven't yet got right.
Right. Okay, so let's wrap up. Okay, we can basically cut this piece out of the show if you don't want to comment on it. Should doctors have the ability to go on strike?
Yeah, really good question. I mean, obviously, everyone's going to have a different view. My view, I'm sympathetic to the junior doctors at the moment, and I think that when you get politicians imposing contracts and criteria on overstretched junior doctors who clearly aren't happy about it, without the adequate level of negotiation, then this is the end result. Obviously, no one wants patients to be harmed, no one wants people to suffer, but I think the junior doctors have obviously got to a point where they feel stretched enough to make this level of protest.
Right. Dare I say, are you going on strike? Have you ever been on strike?
You know
Would
what?
you go on strike?
It's an interesting question. I've been in the private business for 15 years. While I was within the NHS, there was no opportunity in my era to go on strike. I chose to leave a certain aspect of the NHS because I was unhappy. And I was unhappy because of the ridiculous hours I was working, the lack of adequate remuneration I was getting, and it didn't suit me as a person. So I saved myself. Now, I've run conferences where doctors have attended, and the percentage of miserable doctors within the current system is phenomenal across all age ranges. So clearly something is wrong with our system, and clearly somebody needs to start listening to the doctors more to try and address what is wrong.
Dr Charlie from Harley, brilliant stuff as always. Thank you so much for your time. Right, that wraps up Tip TV Health. We'll be back very soon. Thank you.